Let's talk about what the problems are with healthcare right now. First of all, we have a problem with access. There are a lot of people that are uninsured. We're going to address that. There's also a doctor shortage. 35,000 doctors every year are leaving the healthcare profession, and only 25,000 are graduating from medical school every year. Let's talk about the costs of unreimbursed care. Millions of dollars every year are spent by hospitals and individual physicians providing care that they don't get paid for. That is a problem that we need to address. Healthcare and health insurance is expensive. It's too expensive. I agree with you. I am not here to protect the insurance companies or the pharmaceutical companies or anybody else. There are a lot of areas for improvement. Let's talk about that. Another big problem right now is utilization. We're using too much healthcare. Do I think it should be rationed? No, but we are overutilizing. So we all agree that healthcare reform is needed, doctors and patients alike. But is this the right reform? Is Obamacare the right reform? Will everyone have insurance under PPACA? Who are the uninsured? If you look at this pie chart, you'll see in the bottom three sections that 25 million, if you count 52 million as the amount of uninsured patients, it varies between 40 and 55 million. So if you say there are 47 million uninsured, let's just use that number. If you look at the bottom three pie pieces, you'll see that 25 million of the uninsured, this was before PPACA was passed, 25 million consisted of people who either made enough money that they could afford to pay for health insurance, or people who qualified for government programs, or people who qualified for employer programs, health insurance, and they chose not to get it. They've made a choice. That leaves 22 million Americans that do not have access to adequate health insurance. Those are the people we want to address. Now, according to PPACA, according to the Congressional Budget Office, even if everything worked perfectly with this new law, 22 million people would still not have access to health insurance. They would not be covered. We, as tax-paying Americans, would still subsidize their care. So the number of uninsured who really can't afford coverage is no different. 47% of the newly insured people would be put into government programs, Medicare, Medicaid, and SHIP. SHIP is a child health program that's government sponsored. So 47% of the people who would have new health insurance would go into government programs that are paid for by taxpayers, either on the state or federal level, but it's still paid for by us, the taxpayers. Now let's see, let's talk about the individual mandate that they've talked about. So individual mandate means that each person is required to have health insurance or you pay a penalty. Sometimes they're trying to call it a tax, penalty, tax, whatever, it's the same thing. So starting in 2014, $95 will be your penalty if you choose not to have health insurance. That will go up to $695 by 2016, or 2.5% of your income, whichever is higher. But there are certain exceptions. So you can see a list here of different individuals and groups that will be exempted from paying the penalty for this health insurance. So let's see. So they won't be penalized for not having health insurance. So what are the chances are that they're actually going to get it? We will still be subsidizing these individuals. Massachusetts, commonly called Romney Care, is actually called Commonwealth Care. But in Massachusetts, they have an individual mandate, and they've had one for several years. So in Massachusetts, what they're finding is that individuals choose to pay the penalty rather than getting health insurance. Under their plan, as under PPACA, they can choose to get health insurance at any time with no additional penalty. They call the insurance company and get a policy. So they wait until they get sick, they call and get insurance, the insurance companies issue them a policy, when they're well again they drop the policy, and then they go back to paying the penalty because it's a lot cheaper than paying the premiums. As we'll see later, we'll go into the costs of the premiums. So the insurance company is only covering people that are already sick or have very high risk and are paying some insurance premiums. The premiums skyrocket. So the four largest insurance companies left in Massachusetts in 2010 all declared over $1 million in losses. This isn't a sustainable system. Also in Massachusetts, in order to insure additional people, they expanded their Medicare and Medicaid programs. That's the same plan that's going to be happening under the PPACA law. The reimbursement to providers, hospitals, physicians, non-physician healthcare providers, includes rehabilitation, physical therapists, and so forth. The reimbursement often doesn't cover our costs. That's not sustainable either. So providers have stopped participating in Medicare and Medicaid in Massachusetts. The result of that is that patients who, even though these patients may have an insurance card, they can't find a provider. The average wait time now in Massachusetts to see a primary care physician is 48 days.
Oh my God.
Massachusetts has the most physicians of any state in the country and the longest wait times to see a physician. Now you can see here, I'm going to let you look at some of these numbers yourself. But this is a survey by the United Nations International Health Organization, and I've kind of highlighted some of the more interesting parts of this to show you that there are huge differences in the quality of care, the immediacy of care in the United States versus two other countries that are commonly referred to in justification for PPACA, the United Kingdom and Canada. So let's look at one of these. The percentage of patients diagnosed with diabetes who receive care within 6 months of diagnosis. People can die within 6 months of their diagnosis of diabetes if they're not treated. United States, 93%. That's a pretty good number. United Kingdom, 15%. This is what nationalized health care can do to us. So we've talked about who's going to be covered. There are a lot of people that won't be covered. In fact, the number of people with...
I think we should start. Talk about this during a minute.
Referred to in justification for PPACA, the United Kingdom and Canada. So
I had friends from England that their mother was in a wheelchair and needed a hip done in England, which, by the way, has some of the best doctors in the world. She waited 2 years to get the hip in the wheelchair because it wasn't a priority. I know in Canada, if a man gets prostate cancer, it takes 5 months to get to the first doctor. Now, it's a fairly slow disease, but I think these are really important things. Percentage of men and women who survive a cancer 5 years after, U.S., 65%. I had terrible cancer 8 years ago. Yale was saying I had a 2% chance to live a year. Every day I wake up, I go, thank you God for like a bonus day. Because we have great health care. I'm not saying it doesn't have a lot of problems. I'm not saying it's not expensive, but we have like knock your socks off health care. England, 46%. Canada, 40%. I went to school in Paris. I love the French. But for every stage of a breast cancer for a woman, the English lose twice as many women, and the French lose 4 times as many. Now, they're very advanced countries. They're more advanced than us in some ways, certainly in their food. But these are, important things. Percentage of seniors, needing hip replacement who received it within 6 months. U.S., 90%. England, 15%. Canada, 43%. Percentage referred to a medical specialist who saw one within 1 month. U.S. 77, less. The number of MRI scanners, a prime diagnostic tool, you know what those are? They're it's not radiation, but it's like a sort of a CAT scan per million. U.S. we have 71, England has 14. Percentage of seniors, 65 plus, with low income who say they are in excellent health. America 12, England 2%. Does anybody have any questions about this? Because this stuff, go ahead.
About the hip replacement, for instance, maybe you're going to bring up iPad later, but
Yes.
rationing?
Yes.
Rationing, you're going to bring that up later?
That's kind of in one of the later ones, but yeah, we can talk about that.
Are these stats now or before
I think
Obamacare?
they're pretty recent, like I think a year or two. Go ahead. Oh, sorry.
That's okay. We've traveled to Italy and we've traveled to the UK, England, Scotland, thank you. And everybody we met, and they were a bus full of Australians, loved the health care they had in their country, could not believe that we in the United States did not have national health care.
Right.
They were embarrassed and they felt sorry for us.
Matter of fact, in Italy, right, it does. There's good things. In Italy, if you as an American broke your leg, they would fix it. You'd have no charge. There's definitely good things in those countries. The British obstetricians are probably the best trained in the whole world. our chairman at Norwalk, Dr. Hunter, for many years was just phenomenal in every way, ultrasound, cancer, anything. So there's no question there's a lot of good things. Now, in Canada, if a man needs a bypass for his heart, they lose 10 times as many men. This is a little bit out of date, but as we do, because it's such a long wait. So, but we're going to get into some interesting things. So yeah, the people are sort of happy, or like they say in Canada, it's a great health system as long as you're healthy.
We're gonna go on to cost.
Yeah, I just wanted to comment on Sweden. The Prime Minister, I think his name was Olof Palme,
Yes.
had to have orthopedic surgery on his hip or his knee or something. He said, I'm not going to get ahead of the line just because I'm Prime Minister. I'll wait like anyone else. I think he waited 6 months. He missed an international conference that is very important to the Swedes. You know?
Yeah. It's tough that in Canada, it was such a long wait. This is a little bit out of date, but I saw a thing recently that it was such a long wait to get to the CAT scan. But, and they didn't want to take, it might be 6 months, but they didn't want to take you out of order. But if you had, they wanted to keep the machine running all the time. So if you had a cat or dog and $300, you could come in the middle of the night and get them done. That's not out of date.
Yeah, that's another thing.